This year's ESMO will also see an update on the KEYNOTE-040 data, which really, the first line data have held up very nicely. We're seeing a hazard ratio of 0.8, representing a 20% improvement in overall survival. We're continuing to see a greater benefit in patients whose tumors express PD-L1. But what we'll see at this year's ESMO is the presentation of what we call the PFS2 data. And what I mean by that are patients who have received pembrolizumab or standard of care, whose tumors have progressed, and what we did on the study is we tracked how they did with their subsequent therapy. And interestingly enough, the patients who were initially treated with pembrolizumab did better on subsequent therapy than patients who were initially treated with standard of care chemotherapy or cetuximab, suggesting, and this was a significantly different difference, suggesting that the initiation of pembrolizumab, an anti-PD-1 antibody, has an effect not only during the drug's administration, but a positive effect on the therapies that patients receive subsequently. So that immune effect carries forward into subsequent therapy, and obviously it was somehow and partially responsible for the overall survival benefit that we see. It also suggests to us that, in a way, the sooner we start immunotherapy, perhaps the better the patient will do, and moving these agents into earlier lines of treatment now makes even more sense.